Hi there.
Hi, Dr. Camp.
How are you doing?
Doing well. Good to be here. So I'm Dr. Abendigo Reebs, a Naturopathic doctor and a professional associate member of the Naturopathic Medicine Institute, also known as NMI. And the NMI envisions a world where enjoying optimal health allows people to reach their highest potential for inspired creativity. And it asserts that the highest ideal in healthcare must act in concert with the healing power of nature. And today we are joined by Dr. Eli Camp, who's on the board of directors and is a member on the advisory council for the NMI. And Dr. Camp, could you just tell us a little bit about yourself?
Sure. So I'm a naturopathic doctor and I graduated from Southwest College in 2005 and pretty quickly became involved in the profession. You know, I have my practice, but then I really wanted to help support the profession and help it grow, so I started to get involved in other endeavors.
I see. So why are you so excited about the Naturopathic Medicine Institute?
Well, I'll tell you, it has a lot of potential to do some really amazing things, I think, for our profession and for naturopathic doctors, students, doctors who have been out for a few years, doctors who have been out for a number of years. And really, for me, the major goal here is preserving the practice of vitalistic naturopathic medicine. I mean, that's what really gets me excited. That's number one. Number two is that we're providing a platform through the Naturopathic Medicine Institute for those doctors who are really interested in practicing in a particular way, and for students who are trying to learn particular things about naturopathic medicine.
I see. So what are we hoping to accomplish with this institute?
Well, a couple of things, and maybe before I say what we're hoping to accomplish, I should maybe talk a little bit about why this is so important, why it's necessary. So, and I think this happens in any profession, not just the naturopathic medical profession, but any profession where you've got new and innovative things, or where there's a disconnect between people who hold a particular body of knowledge, and then there's a gap, right, in the teaching of that knowledge, whether it's 5 years or 10 years or 15 years. So when I was when I started my medical school career, because I think that's like a mini career in and of itself, I was very fortunate to take philosophy from Dr. Jim Sensenig. And it was very grounding for me in that it helped me transition from a paradigm of treat the disease into a paradigm of the human body has been designed to want to heal itself given what it needs. And I, like many people that I know, were raised thinking about disease as something that happens to us, or, you know, something we catch, or, you know, something that needs to be fought, like it's a war against disease. And when I came to naturopathic school and I sat in class that first week and I listened to this gentleman talking about how the human body was designed to heal itself, given that it has everything it needs, that you remove what's poisoning it or any obstacles to cure, and that you stimulate this innate healing ability within each person, this kind of transformed my life. And then as I went through school, as you know, because you've been through medical school as well, right? We have to learn a lot of things that may seem to disconnect us from a vitalistic perspective, that the body is able to heal itself. And so I went through school. I was very lucky that I was drawn towards homeopathy, which in and of itself is a very vitalistic way to look at the body. We know the body can heal itself. And it wasn't really until I went and I spent time with Dr. Jim Sensenig in his office that I realized what was actually possible, what it really meant to approach healing from a vitalistic perspective. And then, I listened to a lot of lectures from Dr. Jared Zeff, and I was very lucky to have Dr. Letitia Dick Cronenberg teach hydrotherapy, and just to learn from a variety of people that we have really come to call our elders, who hold this very complete, incredible body of knowledge that I cannot seem and couldn't seem to find anywhere else. Okay, so that was one issue, is that there's this amazing medicine that I felt I needed to learn more about way back, and so I did. Well, then it became obvious to me it wasn't just me sort of spacing out during class, right, and not getting the information. There really truly was a gap. And so what happened as I got into practice, I became very successful very quickly, and I ended up having to refer people who wanted to become my patients. I had to find other doctors to refer them to. And so starting about, 7 years ago or so, on an average of 3 to 8 times a week, I would get a phone call, and I would say, to the person, well, I'm full. I have a waiting list that's pretty long. Let's find you somebody that's close to you. And so I would get online and I would start looking for naturopathic doctors, and I'd find someone looked great. Their website looked great. I would recognize their name. And so I would start referring people to naturopathic doctors, and then they'd call me back and they'd say, well, I was really looking for a doctor who practices more like you do. And so I'd say, okay, well, what do you mean? And, they'd say, well, so I'll just give you a simple example. My child has recurring ear infections, and I was offered antibiotics, and that's not really what I was looking for. I don't really want integrative. I want the kind of medicine that my friend told me you did with her, or whatever. And so I quickly began to realize that as a professional, referring people who were looking for a particular style or practice of naturopathic medicine, which we've come to call vitalistic, it wasn't going to be so easy unless I knew who was pretty well grounded, or that's what they were practicing. And so this combination of factors started to come together and coalesce into a need we clearly identified, which was learning, for the doctors learning, and for doctors to be able to refer, and then really for us to have a community of like-minded folks to stick together. And so this is how the Naturopathic Medicine Institute, I think, was born years ago, before I was involved in it. And why I've become involved in it is, now I can answer your question, what do we hope to accomplish? So we hope to educate any doctor that wants to learn more about vitalistic naturopathic medicine, and students. And so any doctor who's graduated, any student who's drawn to this, and provide this as education, right? So for doctors who have already graduated, who have a license and they need to fulfill CE, they do it through continuing education. And then for students, they can learn this while they're in school and continue to learn it when they get out of school. So that's the first thing we're hoping to accomplish, is this passing on this body of information, this knowledge to the next generation before it's gone. 2, educate the public about naturopathic medicine, about what's possible within naturopathic medicine, and then help drive the public or guide the public into finding naturopathic doctors. And then 3, setting up what we have come to call clinical centers of excellence, which will, almost, I could just compare it to the Mayo clinics of naturopathic medicine, where the public begins to realize the level of extraordinary healing that they can find at a clinical center of excellence, and students and doctors can find clinical training and residency opportunities through these centers of excellence. So that's what we're hoping to accomplish, those 3 main things. Why I got involved. We needed to gather as a community. Yeah. And it's grown really fast.
How many members do we have now?
Well, over 200 members just since January, the end of January. and over 500 people who participate weekly in something we call the Vital Conversation, right? This is an hour every Wednesday where Dr. Sensenig and the other elders and fellows of the Institute are gathering to have conversations about how to think like an ND, the way to approach a case like a naturopathic doctor. I was going to say something else, and now it's completely slipped my mind. Maybe
I have a question. So what is the Naturopathic Medicine Institute not about?
Well, that's a really great question, Dr. Reebs. So some of the comments or concerns I've seen arising from folks who are not necessarily involved with the Institute is that, hey, you know, I went to naturopathic school and so I'm a vitalist, or I'm integrative. Are you telling me I'm not a naturopathic doctor because I practice integrative medicine? And so what it's not about is telling people how to practice, right? It's not about saying the way naturopathic doctors are practicing is right or wrong. It's about identifying a very specific philosophy, which is the philosophy of naturopathic medicine, and then those doctors that adhere to the philosophy in a vitalistic way. So what does that look like? Because I know we have a lot of people in the general public who visit our page and will see this video. So it's not integrative, right? It is looking for the underlying cause of symptoms of disease, right? And I'm going to hyphenate that, dis-ease. The body's always trying to be healthy, and symptoms are really just the body's attempt to restore itself to a state of health. And so I'll use the ear infection example again. Instead of antibiotics for an ear infection, what we would do with this person, with this little person who keeps having this, is trying to figure out why. Is it an environmental sensitivity? Is it a food sensitivity? Is it a physical misalignment of the body? And what can we do to support the body to help the body deal with this recurring sort of set of symptoms that comes back? And using an antibiotic is not something that a vitalistic naturopathic doctor would think of first, right? They would be looking at these other ways to restore health. So it's like I said, it's not about telling people how to practice. It's more a practical thing. If you're looking for something or a practitioner that's more vitalistic, well, that's how we're identifying, right, the members of the Institute. And how do you gain that information? Well, you gain that information by getting the education that the Institute is offering post-graduation or even while you're in school.
Wow. So our upcoming gathering, I understand that it's sold out. Is that?
It's sold out. So this weekend, the 19th through the 21st, we're having the Vital Gathering 1 in Phoenix, in North Scottsdale, and it's the first gathering. So there's a process to being identified as a vitalist of the Naturopathic Medicine Institute. This is how, remember I said, you know, a lot of us were having trouble knowing who to refer to. So the goal here is to identify those naturopathic doctors who are coming from this place of vitalistic knowledge, education, and practice. They get a designation of a VNMI, Vitalist of the Naturopathic Medicine Institute, and there's a series of steps they have to go through to be identified, and everybody has sort of self-volunteered themselves to go through this process to get this designation, and part of earning that includes going to 2 conferences this year and then completing a certain amount of curriculum. And so this is the first one, and I think this may be the largest gathering of vitalists I will ever have joined, ever. It's really amazing. There's some really cool people coming. Yeah.
That is so cool.
You're going to be there, right?
I'll be there. Yeah, I'm so excited.
Yeah, it'll be good to see you again.
Good to see you.
So, I mean, this is what we're doing, and it's sold out, but we are videotaping it. And you can go to the Naturopathic Medicine Institute.org website. Anybody who's interested in the recordings, they can buy them now. They're sort of cheaper now than they will be down the road. So that's a good thing to do. And then we'll be meeting again in October for the second conference of the year. And I would suggest anyone who wants to go sign up early as soon as we announce it. I didn't know we were going to sell out, so that was a nice surprise.
That's fantastic.
What do you think so far about the Institute? Are you finding support, and like what does it mean to you? I'm curious.
Oh, the Institute has been so supportive, and it's been helping me in multiple ways. As I start my practice, as you know, I just started my practice about a month and a half ago, actually, here in Portland. And it's great because I can get online, I can ask hundreds of doctors, vitalistic doctors all over the country, questions about cases, and I get a response within oftentimes a half an hour, and it's just amazing. And then I listen to the Vital Conversation every week, and it not only does it provide practical tips on how to approach my patients, how to think like a naturopathic doctor, but it also provides me an inspiration for the week. So I honestly, I'm so grateful that the NMI exists. Yeah.
I agree about the inspiration. I would echo that. Every Wednesday, it gives me, it recenters me in the philosophy, but also in the way to think, right? Think like a naturopathic doctor. I'm not using this to treat that symptom, right? I'm always trying to figure out what the body needs to restore itself to health. So, well, awesome. So, and for all of you out there, I just want to say we're going to be doing this, I don't know how often, right? A couple of times a month, maybe, but we're going to be talking with the fellows of the Institute. So I mentioned vitalists are being identified from that pool of vitalists, those doctors who have been in practice for a significant amount of time, right? Who could really, we say they have clinical mastery of naturopathic medicine from within this vitalistic approach. These folks are the fellows and will be the future fellows of the Institute. And in order to teach through the Institute, you have to be a fellow. So we're really trying to set it up so that we pass it from the most experienced generation to the next. And then we hope to really build this infrastructure up so that it will continue to function like that over time. Which makes sense. I mean, if you graduate from art school, you have all the mechanics down, right? And I think doesn't this happen in a lot of professions? You graduate with this body of knowledge, but then you need time to learn how to apply those tools and use those tools in a particular way. And I think that's really what we're doing.
It's so true, Dr. Camp. And I can truly say for myself, I feel like the learning is really beginning now. And I'm learning from everyone. And I'm just so, I have so much gratitude to be on this journey. So thank you.
Thanks for ringing me up and chatting. And we don't know who our next guest will be.
We don't. I guess now is a good time to wrap up the interview. Yeah. Thanks so much, Dr. Camp, for joining us, taking the time today. As you mentioned, you can go to the Naturopathic Medicine Institute.org. You can learn about our upcoming conferences and events, and you can contact us there at naturopathicmedicineinstitute.org/contact. And at the NMI, basically the laws of cure are seen to be immutable, and the healing power of nature is acknowledged, discussed, unpacked, and celebrated.
Thanks, Dr. Reeves. Have a great day.
Thank you, Dr. Camp.
Bye.
Bye.